Hi, my name is Teresa. I'm trying to do my Nurse 620 medication guide for Cyanocobalamin. I've actually recorded this multiple times, and I'm thinking for some reason maybe it's too long and it's not going. So I'm stuck to doing it through my YouTube again. Anyway, the brand name for Cyanocobalamin is Nascobal and Riberman PC. The therapeutic class is antianemics and vitamins, and the pharmaceutical class is water-soluble vitamins. The mechanism of action is a necessary coenzyme for metabolic processes, including fat and carbohydrate metabolism, and protein synthesis. It's required for cell reproduction and hematopoiesis. The therapeutic uses, it corrects the manifestation of pernicious anemia, which is the megaloblastic indices and the GI lesions and neurologic damage, and it also corrects vitamin B12 deficiency. Um, Routes of administration is PO, IM, subcutaneous, and intramuscular and intranasal route. PO is actually not suggested as it has a poor absorption rate, um, but that is for patients who refuse to do the deep subcutaneous or the IM or the intranasal route. For adults and children, the PO amount is going to be based on their um, B12 deficiency. It can be up to 1,000 micrograms per day. IM subcutaneous for adults is 30 micrograms per day for 5 to 10 days, and then 100 to 200 micrograms per month following that. For children, IM subcutaneous is going to be 0.2 micrograms per kilograms for 2 days, and then 1,000 micrograms per day for days 2 through 7, and then 100 micrograms per week for 1 month after that. Intranasal for adults only is going to be 500 micrograms, which is one spray into one nostril once per week. For pernicious anemia, for adults, the IM subcutaneous is going to be 100 micrograms per day for 6 to 7 days. And if there is improvement, you're going to give the same dose every other day for 7 days, which is 7 doses, which is 14 days. And then you'll do it every 3 to 4 days for 2 to 3 weeks after that. Once the hematologic values have returned to normal, basically once they're in remission, you can give maintenance doses of 100 micrograms per month. And of course, depending on the patient, it can be up to 1,000 micrograms. And you could also use an alternative oral or intranasal formulation for their maintenance doses after that if they prefer. PO for adults for the hematological remission only is going to be 1,000 to 2,000 micrograms per day. And for intranasal for adults only is for hematological remission is going to be 500 micrograms, which is one spray in one nostril once a week. IM subcutaneous for children is going to be 30 to 50 micrograms per day for 2 or more weeks, for a total dose of 1,000 to 500 micrograms. And then you'll give maintenance doses of 100 micrograms per month. And of course, depending on the patient and their needs, it could be up to 1,000 micrograms, their maintenance dose. For adults, you can do a chilling test, which is to check the B12 absorption. And that's going to give a flushing dose of 1,000 micrograms. The availability for this, for the nasal spray, is a 500 microgram per 0.1 milliliter actuation, which is going to be, it equals out to 8 sprays per bottle. And then for the injection, it's going to be 1,000 micrograms, and it's going to come in either a 1, a 10, or a 30 milliliter vial. There are generics available. Also, there's over-the-counter available. For tablets for over-the-counter, it's going to come in 50, 100, 250, 500, 1,000, and 5,000 micrograms. Over-the-counter for extended release tablets, they'll have 1,000 and a 1,500 microgram available. For sublingual over-the-counter tablets, it's going to be 2,500 micrograms. And then for the lozenges that are over-the-counter, it's going to be 100, 250, or 500 micrograms. Drug and food interactions are going to be the chloramphenicol and the anti-neoplastics, as they may decrease the hematological response to the vitamin B12. The colchicine, aminosalicylic acid, or even excessive intake of alcohol or even vitamin C may decrease the absorption and the effectiveness of the vitamin B12 replacement you're taking. You're going to monitor patients for signs of B12 deficiency, which includes pallor, neuropathy, psychosis, red inflamed tongue, before and periodically during therapy. Lab test considerations, you're going to monitor the plasma folic acid, vitamin B12, iron levels, including hemoglobin, hematocrit, and reticulocyte count. You're going to do that before therapy begins, 1 month following therapy, and then every 3 to 6 months following that. You're also going to want to evaluate patients' serum potassium levels, receiving vitamin B12 for pernicious anemia for hypokalemia during the first 48 hours of treatment. And then you're also going to want to do serum potassium levels and platelet counts routinely during their course of therapy after that. Adverse effects include headache, heart failure, diarrhea, itching, swelling of the body, hypokalemia, thrombocytosis, pulmonary edema, pain at the IM site, hypersensitivity reactions, including anaphylaxis. It's contraindicated for patients with hypersensitivity to the drug. You're also going to want to avoid using preparations containing benzyl alcohol in premature infants, as this is actually associated with a fatal gasping syndrome. You'll want to use this cautiously in patients with hereditary optic nerve atrophy, as it accelerates the nerve damage. Patients with renal dysfunction when using the aluminum-containing products, uremia, folic acid deficiency, concurrent infection, iron deficiency, as this response to vitamin B12 will be impaired. You're going to want, for patient teaching, you're going to encourage the patient to comply with their recommendations of healthcare professionals and explain that the best source of vitamins actually comes from a well-balanced diet with foods from the four main food groups. Foods high in vitamin B12 include meats, seafood, egg yolk, and fermented cheeses. And actually, vitamins are rarely lost with ordinary cooking. Patients who are self-medicating with vitamin supplements should be cautioned not to exceed the RDA recommended levels, as effectiveness of megadoses for treatment of various medical conditions is unproven and actually may cause side effects. Inform patients with pernicious anemia that they're basically going to have a lifelong need for B12 replacements for the rest of their life. Emphasize the importance of follow-up with their exams and lab tests. Intranasal instructions, you want to teach them proper administration technique. Always remind them that there is a pamphlet that comes in their intranasal actuator. So you're going to want to teach them, and then you're going to want to demonstrate and actually have them demonstrate it back to you. And the unit must be primed with 3 strokes upon using the first time, and then primed with 1 stroke prior to using the remaining doses. Advise patient to clear their nose, then place tip approximately 1 inch into nostril. Press pump once. You're going to do this firmly and quickly. After the dose, remove the unit from the nose and massage their dosed nostril gently for a few seconds. Each vial is going to deliver 8 doses, and the unit should be stored at room temperature and always protected from light. Additional information, you're going to want to actually include this with a combination of other vitamins, because it's very rare to just have a solitary vitamin B12 deficiency. And you actually want to take this medication with meals, because that helps to increase absorption. It may be used with fruit juices as well. Administer immediately after mixing, and absorbic acid alters stability. Don't let it linger. IV route is not recommended. Intranasal doses should not be administered within 1 hour of hot foods or liquids, as these substances may result in the formation of nasal secretions, which may result in a decreased effectiveness of the nasal spray. Patients with small bowel disease, malabsorption syndrome, or gastric or ileal resections require perineal administration. You're not going to want to take this by the oral route. All right, thank you.